Next up, it's a warning we've heard before, and once again, it's being ignored by far too many. Medical experts urging caution as we head into winter, fearing yet another surge in COVID cases like the one we're already seeing in Europe. Here in the U.S., officials are hoping vaccine boosters will be enough to at least limit the next wave, with Pfizer last week seeking FDA authorization for their additional shots for all adults. But according to Dr. Fauci, that's just a piece of the puzzle.
How quickly we get to the end depends on us. How well we vaccinate, how well we get boosted, and how well we do the kinds of things to protect ourselves. So that's my message to the general public.
Here in Massachusetts, hospitals are once again seeing ICU units at capacity. And that's not just due to COVID, but it is a partial result of people spending the last 18 months ignoring regular checkups and troubling symptoms, just one of the many ripple effects this pandemic has had. So as we keep trying to dig ourselves out of this mess, some are also turning their eyes to the next one. Among them, Dr. Sandro Galea, whose new book is The Contagion Next Time. He's also an epidemiologist and dean of Boston University's School of Public Health. And he joins me now. Doctor, it's good to see you as always.
Good to see you, Jim.
Obviously, your title is borrowed from James Baldwin's The Fire Next Time. Why?
Well, as I say in the epilogue of the book, James Baldwin's book obviously is one of the great books about structural racism, about the impact racism has on everything in America. And the book is a book about the forces in the world around us, racism being one of them, but it's about housing, it's about air pollution, it's about income inequality, it's about people not having livable wages, and also about racism, and how those forces actually created the conditions that found us when the pandemic hit, and how those forces are the forces we need to tend to if we are going to insulate ourselves from the next pandemic.
Before we get to them, we're in the middle of this pandemic that's killed more than 750,000 people in this country, 5 million worldwide. Yet your first chapter is essentially about optimism. What do we have to feel good about?
I think we have a lot to feel good about. And I think sometimes, when you have someone like me on, you're always looking for the bad news, Jim, and I understand that. But I think it's important to remember that we are actually living in the healthiest time in human history. Human life expectancy was 40 years for most of human species. But in the past 150 years, it has gone up to roughly 80. But the reason I tell this story is not just out of sort of cheerleading, but to ask what is it that resulted in our health getting so much better? And the reason our health got so much better is because we cleaned up our cities. All of a sudden we had safe food to eat. All of a sudden we were free from as much violence as we had before. That made an enormous difference. And what I try to tell in the book is, let's learn the lesson from that and ask ourselves, what should we do to make ourselves healthier now? And in part, I'm trying to move us away, from thinking the wrong way about our health.
Well, we are a rotten nation when it comes to lesson learning, but we'll return to that in a minute. Despite the good news, though, in your book, you suggest we are not prepared for the contagion next time. The problem, as you write, is we invest vast amounts of money in healthcare, but comparatively little in health. What does that mean?
Well, it means actually exactly what it says, which is in our context, we spend more on health than any other country in the world. But we actually have worse health than all other high-income countries. And the reason is simple. We put all our money in healthcare, in hospitals, and medicines. But we don't put our money in what actually makes us healthy. And what makes us healthy is where we live, where we work, where we play. And we saw this play out with the pandemic, right? The pandemic was enormous triumph of vaccines, enormous triumph of biomedicine. We got to vaccines in record time. We got to vaccines in 8 months, when normally it takes us a decade. In our hospitals, we did very well in looking after sick patients with COVID as well. These are the areas we invest in. Well, what did we do poorly in? Well, we did terribly in our politics, in our public health infrastructure, in people having houses they could actually live in without giving COVID to each other, and people having jobs that they felt secure in and be able to protect themselves from COVID. Those are the areas we did poorly in. And frankly, it's because we've underinvested in those areas. So it was a nice illustration, the pandemic. I mean, nice if I may say that the areas we invested in, treatment, vaccines, hospital care, those we did very well in. We did terribly in all the other areas. And the pandemic was a tragedy and still is a tragedy. More than 700,000 Americans died. That's a lot of people. And that reflects how important it is that we pay attention to the other things, not just medicine.
Much of my earlier life, I was a lobbyist at the State House and in Washington, at Congress. Prevention is not part of the lexicon of many elected leaders. A little too abstract. The return is not immediate enough, I think. But you give a wonderful example in your book about firefighting. Could you share that with us?
Yeah, firefighting, I think, is a great example. Firefighting has been with the world for a couple of thousand years. And with the Roman Empire, they realized that their houses were burning down, so they created fire departments. And the model of firefighting for 2,000 years was the same. You have a bunch of people sitting there waiting for a fire to start, then they run out and try to put it out. About 50 years ago in this country, a prominent firefighter said, well, what if we as a fire department played a role in actually preventing fires? What if we worked with municipalities to create fire codes? What if we inspected buildings and made sure they had sprinklers? As a result, today we have half as many fires as we had 50 years ago. Now, we still have fire departments, right? Because there are still fires and we want a good fire department when there's a fire. But surely we can all agree the world is a better place because we have fewer fires. And I suppose that's what I'm arguing in the book. Let's create a world where when the next pandemic hits, we're not sitting ducks. And let's make prevention, to use your word, part of something that we accept.
Well, prevention was my word. Another word I used after having read your book is reparations. I mean, that's really how I see your agenda. You mentioned it briefly there, but you seem to avoid it. Is that intentional?
I don't think it's intentional. I've actually published a paper in the New England Journal of Medicine last year with my good colleague, Dr. Mary Bassett, talking actually about, in particular, Black reparations. And fundamentally, we argue in this piece, and I suggest in the book, that what you're trying to do is you're trying to close health gaps. And if health gaps rely on underlying gaps in assets and resources, well, you have to fix that. And to do that, you somehow have to repair damage that's been done in the past, which is ultimately what reparations mean. So to my mind, I think it's a word that's been very much politicized, but I think it has a very real meaning towards getting us to the kind of health equity that we talk a lot about that we want, but often our words are far ahead of our actions.
But it seems to me that to get where you believe we have to go, and I'm assuming there is nobody who does what you do, no matter what their politics are, who would not agree that all of these things would lead to better outcomes. But as I said a minute ago, we are not good lesson learners in this country when it comes to healthcare, when it comes to war, when it comes to anything. So let's talk about current events, if we can, just for a minute, that we maybe can learn lessons from. Are you optimistic as well about where we currently are, as I said in the intro, with winter months coming, with immunity fading for at least some part of the population? Or are you worried about the surge next time?
Well, I am worried, but I think worry can exist with optimism. I think they can coexist. I think I may disagree with you, Jim, that we're not good lessons learners. And, perhaps it comes from a place of profound confidence in this country. As an immigrant, I suppose I have the dispatch to say, I've seen this country learn, I've seen this country get better, and I believe it actually can. So, we've, in the past 40, 50 years, there have been enormous changes in this country, many of them for the better, some for the worse. So I see no reason why we actually cannot learn from this moment. So am I optimistic? You and I are having this conversation. The conversation about health equity, about the disadvantage that COVID-19 has brought on particular groups, particularly people of color, people who are low-wage earners, is now on the front page of newspapers. It's featured on shows like yours all the time. It wasn't like that 5 years ago. So that makes me optimistic. It makes me optimistic that we're bringing these issues forward. And it's a little bit long overdue, but it's okay. We're getting there.
I want to challenge your challenging of me in a minute, but I want to stay on current events for a minute. Ed Young has written terrific stuff about the COVID-19 in the Atlantic. Piece that came out today, I want to read you one quote. The U.S. Bureau of Labor Statistics estimates the healthcare sector has lost nearly 500,000 workers since February of 2020. Morning Consult, a survey research company, says 18% of healthcare workers have quit since the pandemic began, while 12% have been laid off. Well, I totally subscribe to your notion that health has got to be at least a contemporaneous priority. How does healthcare survive with those kind of numbers?
I think those numbers are alarming. There's no question about it. But, it survives. You know why it survives? It survives because we are at a moment where young people are seeing the potential of a career in health like never before. We're discussing this a little bit earlier. We've seen nationally about a 30% increase in applications to schools of public health. You're going to see more and more young people who want to be doctors, who want to be nurses. And you know what? That's a good thing. That's a real positive. Now, that doesn't change the fact that it's hard right now. It doesn't change the fact that there are many healthcare providers right now who are burnt out, many public health professionals who are burnt out. And I suppose I'm taking the long view. I'm playing the long game. I think we need to support the people right now who are burnt out right now, but we also need to invest in the next generation who's going to take us forward.
One last thing about that even I was optimistic about that concerns me in terms of current events. The really good news about these antiviral pills from Pfizer and Merck. On one hand, the good news is if if you'll excuse my expression, I know you wouldn't use this, stupid enough to be unvaccinated, you can be saved if you treat your symptoms quickly enough. The bad news from my perspective is it gives even more reason for the unvaccinated to stay unvaccinated because they can be saved down the line. Isn't that a concern of yours?
Well, you talk about moral hazard with these things, which is always a concern. But I think fundamentally, the more tools in our armamentarium we have to deal with COVID, the better and the faster it is. COVID is going to be with us in the long term. We know that it's going to become endemic. So fundamentally, we want a balance of vaccines and therapeutics in order for us to be able to control the severe morbidity and death from COVID. Once we can do that, we can get on with our lives, even though COVID is still with us.
Okay, so let's return to your optimism if we can for a second. I'll challenge it once and then I'll join it for one final thought. This is a country where every single Republican in the Congress will not support a bill that does many of the kinds of things that you're talking about to improve health in this country, namely strengthens affordability of higher education, affordable housing, brings 47 to 50% of kids out of poverty with a tax credit, makes child care universal and affordable. If so many people refuse to embrace those things, why would they embrace even a broader agenda like you're prescribing in your book?
Because we have shown time and again that once the national conversation changes, politics change, politicians change. And we are having that conversation slowly. And the conversation we're having in 2021, Jim, is very different than the one we used to have in 2015, which is very different than 2010. And we saw the country change, for example, in the 80s. I mean, the country in 1980 was very different than the country in 1970 and 1960. I am optimistic that the country in 2030 will be different than 2021.
See, my perspective, and this is where I am optimistic, I think the beauty of your prescription, as I've called it, to deal with a public health crisis, ordinarily we would have to appeal to the selflessness of people in this country to care about others who aren't as fortunate as you and I are. But I think you have great potential to appeal. You generically have great ability to appeal to the selfishness of Americans, because when they get sick, because these other conditions aren't addressed, I get sick and you get sick. Isn't that really the way to sell this? It may not appeal to your sense of morality, but isn't that the best political way to sell this agenda?
I think it's one way to sell the agenda. I mean, fundamentally, if we don't learn from the pandemic how interconnected our health is, because as you said, Jim, if you get sick, it increases my chances of getting sick. Even if I don't care about you, I actually don't want you to get sick because I don't want myself to get sick. But I think there are plenty of people in this country who are motivated by altruistic reasons or reasons of sort of what's morally the right thing to do. But I think there are others who are motivated by much more by self-centered reasons. And I sort of feel like it's okay. All of these reasons point in the right direction. But the pandemic is surely a moment where now is the time to learn this lesson. And the reason I framed the book as The Contagion Next Time is, in this teachable moment, how do we make sure that we put in place what we frankly should have done 5 years ago, 10 years ago, 20 years ago to prevent us from having the same harm with the next pandemic?
I hope you're right about everything, Doctor. Congratulations on the book, and thanks so much for your time.
Thank you, Jim.